is that there you go. And the second thing I want to mention is that if you have any questions, you can either post them in the chat or directly to Davide Dragone, who's sort of handling the Q&A. And with that, I would like to give the word to Angelica. We're very much looking forward to your seminar. Thanks for joining us.
All right. Thank you so much for having me. Can everybody hear me well? Excellent. I am so excited to be here. Good morning, everybody. At least good morning in my part of the world. I'm calling from New York City today. I am very excited to be here. I will be presenting joint work with Adrian Rubley and Jamie Cunningham titled State Recreational Cannabis Laws and Racial Disparities in the Criminal Legal System. This paper is probably 3 years in the making, and it was just recently accepted at AEJ policy. So it's more sort of advanced work at this point, although we are working on extensions to some of this work. So I am very excited to hear any future directions that you think we should be considering going forward. Yeah, so let's get started. Why can't I? Okay, can you see one slide or two slides?
Now we see two.
Let me see why that is the case. Maybe can you see one slide here?
Yeah, that works.
Okay, then I'll just scroll it. So in a nutshell, this study is interested in elucidating the direct and the spillover effects of cannabis legalization in the United States and how this might affect racial disparities in the criminal justice system. In particular, we're going to consider two main types of outcomes. One, law enforcement type of outcomes, and number two, outcomes that might be reflective of criminal activity. And to study this question, we are going to exploit the staggered implementation of cannabis legalization in 11 states. This is recreational cannabis using a difference in difference framework and many administrative data sets that span the period from 2007 through 2019, right before the COVID pandemic. I think to sort of ground the mind, it is helpful to start thinking about what is the relationship between cannabis and crime. And although there is a lot more detail that we can think about than what I probably have time to explain, and it's in this slide, what we know is that cannabis and crime are correlated in the data, and that substance use more generally is correlated with crime in the data. So to give you some statistics, in the United States, about 85% of prisoners have a substance use disorder or were incarcerated for a crime involving drugs. And similarly, depending on the city, around 63 to 83% of adult male arrestees test positive for drugs at the time of the arrest, and cannabis is the most used drug among both prisoner and arrestee populations. When we think about how particularly, cannabis might be related to crime, we can think in general of four potential pathways. Two are related to drug prohibition, and then two are related to cannabis use itself. From the cannabis prohibition pathways, drug prohibition itself defines cannabis possession and sale as a crime, right? So when you have these types of laws, then possession and sales of cannabis can be considered to be a crime. Then additionally, drug prohibition removes legitimate conflict resolution mechanisms, which can induce systemic violence to enforce contracts in illegal drug markets. We do know that illegal cannabis sales in the US are primarily done indoors, and that cannabis markets are less violent than other illegal drug markets, but there is still evidence of violence generated by the cannabis markets. The pathways related to cannabis use, we can think of them as including, number one, the psychoactive effects of cannabis. Even though we believe that cannabis use might reduce, violent crime by inhibiting aggression, it might induce other types of crimes such as DUI or driving under the influence, public intoxication, property crimes, other sort of types of crimes. Additionally, we can think of cannabis use as inducing economic crime, which is crime to finance the consumption of cannabis and other substances. Additionally, cannabis is the most commonly used illegal drug in the United States, and it's possible that such a huge illegal market is correlated, that the production and consumption of cannabis is correlated with the production and consumption of other illegal drugs. And so another way through which changes in the cannabis market might affect crime is through the effects that they might have on the consumption and production of other illegal drugs, and how these markets might be correlated. So the war on drugs has taken a huge toll in a variety of societal costs. So generally, annually, we spent $47 billion per year in drug prohibition enforcement. In 2018 alone, police made over 600,000 arrests for cannabis possession and sales, which exceeded arrests for all violent crimes combined, which is pretty shocking. And in the figure that we have here to the right, what we can see is how these arrests, of all drug arrests, how many are attributable to, these are all drug arrests related to substances. Possession and sale of cannabis represent about 40% of total drug arrests, with the majority of them being attributable to possession offenses and 8% for sale and manufacturing. In 2019, drugs were the most serious offense for serving time among 46% of federal prisoners and 14% of state prisoners. And the costs of drug prohibition exceed just those from incarceration, but also it can cripple access to jobs, loans, housing, and other social supports. And of course, it might create street violence from the creation of an illegal drug market. To have a sense of, so cannabis prohibition has had a disproportionate effect on communities of colors, especially among Black communities. And to see or to have an idea of how or the extent of this, what we have plotted here is the share of arrests for Black, white, and other races, and the red column clarifies the share of that population in the overall U.S. population, and then how they're represented in cannabis arrests, total arrests, and prisoners. Okay, so for example, in the very first figure titled percent of arrests for each race, in the first we have Black. So the Black population represents about 12% of the US population overall. However, they're greatly overrepresented in cannabis arrests and total arrests, right? So they represent over 32 or 33% of cannabis arrests, and about 27% of total arrests, despite only being around 12% of the US population. When we move to percent of prisoners for each race and ethnicity, what we find is, again, even though Black populations represent about 12% of the US population, they're represented in more than 40% of prisoners, right? So there is a great overrepresentation in these outcomes for Black communities. They're also overrepresented in homicide victim outcomes. So even though, again, Black populations represent about 12% of the US population, they represent nearly 50% of homicide victims in the United States. This is similarly seen in hospital data through assault hospitalizations and gun injury hospitalizations. Meanwhile, I say other populations are underrepresented in these outcomes. Some people believe that cannabis legalization might help correct some of the damage of drug prohibition on racial disparities in the criminal legal system. So In the United States, as of 2024, 24 states and the District of Columbia have passed recreational cannabis laws. And what these laws do is that they allow individuals 21 years or older to legally possess, use, distribute, and sell cannabis subject to amount limits and other regulations. These laws were generally predated by medical cannabis laws, which authorize physicians to recommend cannabis use for patients with eligible health conditions such as cancer, pain, multiple sclerosis. It depends on the state. And some of the states also have cannabis decriminalization laws, which reclassify for small cannabis possession offenses, reclassifies them from criminal to civil offenses, but they do not offer protection for sale offenses. So cannabis legalization may reduce crime and associated law enforcement through a variety of pathways. It may reduce law enforcement outcomes and costs associated with cannabis-defined offenses, right? Because we no longer define cannabis possession and sales as a crime. So police, law enforcement cannot come after you if you're, for these offenses anymore. It is possible that it might reduce street violence and crime from any cannabis trafficking. It may create and increase access to legal jobs in the legal cannabis market. At the same time, individuals who were employed in the illegal drug market might lose their jobs. So it's unclear how the net effects of that could play out. It is possible that legalization can generate tax revenue, which can then be invested in social programs and law enforcement to prevent crime. So we think that these are some of the mechanisms through which cannabis legalization may reduce criminal activity and associated law enforcement. However, the net effects of cannabis legalization on crime and law enforcement are on the net unclear due to potential spillover effects because cannabis legalization might increase cannabis use. And we have seen evidence of this in the literature more generally. And greater cannabis use, some argue that might increase crime through the psychoactive effects or through the economic crime pathways. It might result in, depending on whether other substances are substitutes in production or in consumption for cannabis, changes in cannabis use may affect use and trafficking of other drugs such as opiate and alcohol. Prior literature has found that cannabis liberalization policies reduce opiate prescribing and some opiate related outcomes. It's a little bit more mixed for alcohol. And it is possible that cannabis legalization, because the police can no longer book you for certain cannabis related crimes, that they use those efforts to pursue other types of crimes, which might be reflected through increases in arrests or other law enforcement outcomes. So let's dive into the research design. So we consider a large set of data sets. We actually use, I can't even remember, but when we had to work on the replication package, I think it was over, I mean, probably over 16 different data sets. So I am not going to sit here and list 16 different or more data sets, but in a nutshell, I will describe those that we use in our main specifications or in our main outcomes very briefly. And some of the key outcomes that we consider from these data sets. So the main data set that we use is Uniform Crime Reports by the FBI, or the Federal Bureau of Investigation, and it reports arrests by age, sex, and race. From this data set, we're going to use cannabis arrests, other drug arrests that aren't cannabis, non-drug arrest rates, and total arrests. We're also going to consider incarceration data from the National Corrections Reporting Program. We're going to look into drug offenses, so prisoner admissions for drug offenses, for non-drug offenses, and total prisoner admissions. And then from the National Prisoner Statistics Program, we're going to consider total prisoners at year end. One thing to note, a limitation of these data sets is that it records the most serious offense associated with an incident. So for example, in arrest data, let's suppose that someone is arrested for a variety of crimes. We are only going to see in the data the most serious offense. So if somebody was booked for burglary and also cannabis possession, it only is going to be reflected as burglary. So we're not going to see, there's going to be a lot of incidents that do involve possession and sales of cannabis or other types of criminal activity, but it's not really reflected in the data, as only the most serious offense will be reflected in this data. We are also going to look at data that, or at measures that might reflect criminal activity. A limitation of criminal activity measures is that many of them do not include race and ethnicity, and that is a key feature that we're interested in for the purpose of the study. But we're going to do the best that we can with the data sets that we have. So one, we're going to use hospital discharge data from the Healthcare Costs and Utilization Project. So basically, this is going to tell us, or we're going to look at all hospital admissions in an inpatient, with an inpatient stay that have an ICD or International Classification diagnostic code that indicates cannabis use disorder or cannabis use or dependence. And hopefully this will help shed light on are there changes happening in terms of cannabis use, in particular, a more serious type of cannabis use. We are also going to consider reported crimes and call for service data. Like I said, crime data usually do not include information, even though arrest and prisoner data does include information on the race and ethnicity of the perpetrator. Here, for calls of service, for reported crime data, we do not have the race of the victim or the perpetrator in basically most of these data sets, but the data that we're going to use does include latitude and longitude, which allows us to identify the geographic region where an incident has occurred. And what we're going to use that information to know whether certain incidents are happening in disproportionately minority neighborhoods versus neighborhoods that aren't primarily minority neighborhoods. And that's how we're going to try to get at the disparities in that situation. Then lastly, we are going to try to measure street violence with National Vital Statistics System, multiple cause of death. In particular, we're going to generate measures of homicides overall and those involving gun injury. And then again, using the same hospital discharge data, we are going to measure assault hospitalizations overall and those involving gun injury. Did someone have a question?
No, none so far.
Okay. We are going to consider 3 types of disparity measures. One, we are going to stratify results by race and ethnicity. So we're just going to consider rates by race and ethnicity. And then we are going to test for disparities using 2 measures. One, relative disparities compared to the white population, which is the largest group in the US. And then absolute disparities, which subtract the rate from the rate for the white population from the rate of a different group. And the racial groups we're going to consider are going to be non-Hispanic white and non-Hispanic Black. These are going to be indexed by a geographic area, which depending on the many data sets that we use could be at the county level or at the state level. And then we are going to also, it's indexed by T, which might represent a time period, which could be a year or a quarter year. So with all these data sets, what we're going to do is that we're going to use our standard difference and event study regression models. And they are going to exploit the staggered implementation of these recreational cannabis laws in 11 states between 2007 and 2019. And here we are showing what these states are and the year in which they implemented cannabis legalization. So we have a mix of states. Washington State and Colorado were the first ones to implement in 2012. And then we have 11 states that we're capturing during our study period. So our regression models are going to control for area fixed effects. So that could be, again, a state or a county. And this is to control for time invariant differences between geographic units. We're going to control for period fixed effects, which is at the quarter or the year level. This is to control for nationwide trends and outcomes that might be biasing our estimates. And then lastly, we're going to control for cannabis decriminalization laws in those states that had such laws prior to recreational cannabis law implementation. We are going to use our standard two-way fixed effects specification. Y is the outcome of interest, which can be the rate ratio, or the rate difference as defined in our prior slide. RCL is our cannabis legalization indicator of interest. It's equal to 1 if the policy is enacted in that state and year, and 0 otherwise. The control variables, period fixed effects, area fixed effects, and cannabis decriminalization laws. We're going to weight regressions with population estimates that correspond to the race and ethnicity where that regression is focusing for whatever group that regression is focusing on, and that also correspond to that state and year. And for statistical inference, we're going to cluster our standard errors using the standard cluster robust variance matrix estimator. This is just the very standard event study specification that includes lags and leads of the policy to see if there are any delayed effects or anticipatory effects of the policies, and it can help shed light on whether the parallel trends assumption, which is required for difference and difference methods, seems reasonable, and whether the effects of the policy came in the form of level shifts, if any, or if they were dynamic over time, meaning are they increasing or decreasing over time.
Angelica, may I interrupt you for
Yes,
one question?
of course.
So
Yes.
this is more about the mechanism that you presented before.
Yes.
Nothing is connected with ethnicity. So can any of these or the predictions that you presented or the possible mechanisms be linked also to ethnicity?
Well, so what we do for ethnicity is we define where possible in the data. We use white non-Hispanic, Black non-Hispanic, where the data allows. However, our main set of results, which is the arrest data, it doesn't really start documenting ethnicity until pretty late in the data. So because of this, we ended up not displaying estimates for Hispanic groups just because we couldn't really present results for this group in our main findings. So we ended up just focusing on white non-Hispanic and Black non-Hispanic, or Black or white, if that is what the data is, if that's all the information that we have in the data.
Thank you. Thank you.
So we also test, of course, the robustness of our findings and we have an 80-page appendix with 1 million robustness checks to last a lifetime. I did not include these 1 million robustness checks for the purpose of this presentation. I just focused on the main findings, but we have pretty robust estimates. I'll tell you some of the robustness checks that were included. We considered wild cluster, since we have 11 states that are switching. One might be concerned of statistical inference when you have such a small number of treated states. So what we do is that we also test our statistical inference to the wild cluster bootstrap approach to improve statistical inference when the number of treated clusters is small. We also test the robustness of our findings to including additional controls, including medical cannabis laws, cannabis record expungement laws, and the unemployment rate. We also consider the more novel difference in difference literature, which considers new estimators that are robust to treatment effect heterogeneity across time and across over time and across states. In particular, we present diagnostic tests to see if there's any negative weights attached to our two-way fixed effects approach, and then we estimate using the multivariate DAD estimator, which is the one proposed by Chase Martin, as an alternative estimator to the two-way fixed effect. And we consider other, I think we do like 5 different or 4 different of these novel estimators. We also consider a specification that replaces the recreational cannabis law indicator with an indicator of the dispensaries. Not all the states, when they implemented, they allowed retail sales of cannabis. Most did, but not all did. So we instead, to see if this is coming from a legal change or if it's coming from a consumption pathway, we check using the RCL dispensary indicator, and then we control for potential spillover effects across jurisdictions. So we do a variety of things, and we have pretty robust results across the board. Here I am just showing you the diagnostic test from the proposed by Chase Martin. And here is just telling us what, for the different data sets and outcomes of interest, what is the percentage and sum of negative weights. And what we can see in our arrest data, there are a little bit of negative weights, but for the most part, they're really small, and most of our outcomes are not affected by negative weights. Okay, so that's a lot of information. We are ready to dive into these results. So I'm going to start by presenting our arrests findings. I like starting with the raw data. Here we have arrest rates by time since the implementation of recreational cannabis laws. The way to interpret this graph is you see a red line. What this line is indicating is the timing of legalization. So this is when the policy becomes legal. And 0 is the period right before legalization, -1, 2 periods before, and so on and so forth. And 1 is the first period of legalization, 2 is the second period, 3 is the third period. And what we can see is a sharp decline in cannabis arrests for both Black and white populations at the time of cannabis legalization. We see that there is a decline basically across the board. The decline looks bigger for Black populations, but they also have a higher baseline mean. However, when we move to total arrests, we don't really see much action. It doesn't seem like total arrests have changed much as a result of cannabis legalization. Of course, when we look at the y-axis, cannabis arrests are a small share, at least in these states, of total arrest. So that's what we see. Here we have the DID estimates. Here's the effect of recreational cannabis laws on cannabis arrests. Panel A has cannabis arrests overall, and then we stratify by possession arrests and sales arrests. So we stratify whether this is coming from possession of cannabis or sales of cannabis. And what we find is that there is a decline in cannabis arrests across all races, all race groups, white and Black. And this is coming from both cannabis possession arrests and cannabis sales arrests. This is very consistent with the policy of interest, which legalizes both possession and sales of cannabis. These are very large effects, which we are documenting. And we can see, we don't find changes in the rate ratio, but we do find changes that are statistically significant for the rate difference between Black and white populations. Here are our event study plots. I've already sort of shown this in the raw data, but what we can see here is that there is clearly an effect of cannabis legalization on arrest rates, and it is a big level drop. And we see it for both white and Black populations. It happens right away after legalization. We then consider what happens to other drug arrests. Like we talked earlier, the market for cannabis is by far the most prevalent illegal drug use in the United States. And when I say illegal, it's illegal federally. And the changes in the legalization of cannabis might affect not just the market for cannabis, but the market for other illegal substances. And so we are interested in seeing what happens to that. And so we look at drug arrests for other substances, and we stratify that again by possession arrests and by drug sales arrests. And what we find is that there are no statistically significant changes in drug possession arrests following cannabis legalization, but we do find changes in sales for other illegal drugs. Specifically, we find declines in the sales of other illegal drugs, and they are pretty sizable, and they are evident across racial groups. There's decline for both white and Black populations. We are unable to detect whether these declines could reflect either reductions in illegal activity. It's possible that illegal drug markets are affected by declines in illegal cannabis use. However, they might also reflect changes in law enforcement practices. Perhaps some law enforcement are investing less in cannabis and cannabis enforcement, and law enforcement of cannabis prohibition. And if some suppliers supply both cannabis and other substances, it's possible that just a disinvestment in prohibition of cannabis enforcement is resulting in a disinvestment in the prohibition of other substances, just more generally, if they happen together, or if overall law enforcement has decided to shift their efforts to other types of enforcement of other types of offenses. Then we look at what happens to the effect of recreational cannabis laws on non-drug arrests. And we consider overall non-drug arrests, and we stratify this by Part 1 arrests and Part 2 arrests. Part 1 arrests are sort of index crimes, which we consider to be the more serious types of violent and property crimes like homicide or robbery, rape, aggravated assault, whereas Part 2 arrest would be burglary or I'm just blanking out right now, but sort of the property crimes that are like theft and the property crimes that are considered to be more serious. And what we find is that there doesn't seem to be an effect of cannabis legalization on Part 1 arrests. We don't see that legalization of cannabis is changing much for serious arrests between Black and white populations more generally. But when we look at lower level offenses, so the Part 2 offenses, we do see some evidence of increases in arrests. So we find positive effects for both Black and white populations. However, the effects are only statistically significant for the Black population, and we detect them as in the rate difference calculations as well. One thing to note, though, is that the event study plots for this specific finding are a little bit less strong than for our other results. And so we don't want to generalize too much from this finding, because our event studies aren't that clean and perfect. So we take them as suggestive evidence of a potential increase in Part 2 arrests, but we aren't, we take that with a grain of salt and don't want to overinterpret that finding. We then finally consider what's the effect of cannabis legalization on net or total arrests, and we don't find any statistically significant effects of cannabis legalization overall. Again, this is not entirely surprising because even though we find really large declines in cannabis arrests, perhaps it's not, the declines are not large enough, or the size of cannabis arrest is not large enough to have a net change in total arrests. And there is also the possibility that there is this substitution in Part 2 arrests, although again, we don't want to overgeneralize. We then consider incarceration using prisoner admissions. And what we find here is this reflects prisoner admissions for drug defined offenses. So this is imprisonment for cannabis, not cannabis. This data set did not indicate the substance involved. So this is any drug defined offenses. But we do see declines in prisoner admissions for white groups. However, we do not see the same decline for Black populations. In a way, so this, at least for the white group, this might be consistent with the declines we documented in both cannabis possession and sales. This is going to be primarily sales related, sales of controlled substances, and we found declines both for cannabis and non-cannabis drugs. So these declines might correspond to those declines in arrests that we find. However, as we can see, it's kind of surprising and unclear why we don't observe similar declines for the Black group. Here are the DID estimates. So for the effect of cannabis legalization on prisoners. So panels A, B, and C look at prisoner admissions using one of the prison data sets. We consider two to get a sense of sort of the stock of net prisoners at year end is what panel D reflects. And what we can see is that, consistent with the event study figures that I just showed above, there is a decline in prisoner admissions for drug-defined offenses, but it's only happening for white populations. We don't see this for Black populations. And for non-drug defined offenses or total prisoner admissions, we don't really see any effects. We also don't see any effects overall for total prisoner admissions at year end. This is not last but not least. Then we're going to talk about, so far what we have seen is that for our law enforcement outcomes, we do see some declines in law enforcement measures for drug-defined offenses, but we can't really tell whether these declines are coming from changes in police activity or if they're coming from changes in criminal activity, right? And what we're trying to do here in these next series of outcomes is trying to see if we can at least shed some light of, is this happening through changes in, is this consistent with changes in criminal activity, or is this consistent with changes in law enforcement activity? And so for that, we try to look at evidence, data that measures reported crimes or calls for service. And also we're going to look at homicide deaths and assault hospitalizations. This in a way to get at the mechanisms related to street violence, systemic violence, and mechanisms related to criminal activity for, again, it could be changes in street violence or, criminal activity to find economic crime to finance the drug, or other types of crime that might be influenced by substance use. So first, we are plotting here the data on criminal activity in minority neighborhoods relative to other areas. Here, what we do is that we use, again, call for service data or reported crime data. So call for service data is data that comes whenever somebody calls 911 for an emergency call, or whenever, even if it's not an emergency call, sometimes, many times people call the police for support whenever they've experienced a criminal incident or need help. And that is call for service data, whereas reported crime data is officially reported crimes to police. And this data comes from publicly available, these are all publicly available data sets, which include latitude and longitude. And this is all from states that legalize cannabis. And they do not reflect the entire state, but the specific city that is being reflected here. So we have data from Portland, Seattle, Sacramento, Denver, Washington, and then the state that that city is from. And what we can see is, so these plots here, what they're doing is that they're plotting the raw data. This is so that we can see what does incidents, either coming from calls for services or reported crimes, look like before and after cannabis legalization in those cities. I will break down these totals in the next slide, but what we can see here is, in general, there doesn't seem to be much of an effect in total incidents in these cities following legalization, at least not relative. So what we're doing is the black line with dots has minority areas or neighborhoods defined at the census tract level, and other areas are sort of tracks where the proportion of Black persons is lower, and minority areas has areas where the proportion of Black persons is higher in that city. And we either don't see any effects, or in some cases, maybe even a slight decline following cannabis legalization. And in some cases, this seems to be more clear. In minority areas, at least, we can see a little bit of that for Portland, Seattle, Washington, D.C., Denver. Some of the other states or cities are not particularly affected by cannabis legalization. In this slide, we actually stratify by drug-defined offenses, other offenses, so violent crimes, property crimes, which are the Part 1 offenses, then Part 2 offenses, and then net effects. And in the top, so the reason we decide to present we present the pool estimates and the estimates by each city. A couple of things. So here we are comparing incidents before and after legalization for minority neighborhoods relative to non-minority neighborhoods. So remember here that all these neighborhoods are in RCL cities, so all the neighborhoods are affected by cannabis legalization. So these estimates here reflect if there's any relative change in incidence between minority and non-minority neighborhoods. Okay, so this is more like what's the differential effect? And one second. And we present them the pooled estimates, which is the first panel where it says pooled, but we also present them by specific city. And the reason we do that is because this 911 data or call for service data, reported crime data, varies a lot across cities. And although we did our best effort to try to harmonize these measures across cities to be as similar as possible, this was very different given how different these offenses, the types of offenses that are collected or the type of information that is available is very different across cities. So we felt that just reporting pooled estimates would, given these differences, we felt that it was more clean and clear to just report what we find for each city, and just for interest, show the pooled estimates. And what we find, I will focus in the pooled estimates. We find declines in drug-defined offenses in minority neighborhoods relative to non-minority neighborhoods. These are pretty large. I think this decline of 1.39 offenses, decline in offenses. It's about a 45% decline in minority neighborhoods relative to non-minority neighborhoods for drug-defined offenses. This is pretty substantial, and it aligns with our findings for arrest data. When we stratify the data by other offenses, we see that the point estimates are negative across violent, property, and Part 2 crimes. They're not really significant for violent and Part 2 crimes. We do observe some smaller declines for property crimes and small declines for the net effect. But I think the main thing that this is showing is that we do not find increases in violent crimes, property crimes, or Part 2. In using these measures for the cities that we consider, we do not find evidence that cannabis legalization increases these offenses, and especially we don't find evidence that it increases these offenses in Black neighborhoods relative to non-Black neighborhoods. When we look at stratification across cities, the finding of declines in drug-defined offenses seems consistent across many of the cities that we see here, whereas for some of the other measures, it's a little less clear. I mean, the effects are basically negative for many of the cities, but they're not statistically significant for several of them. So punchline is we do not see any evidence that there are increases in other offenses, which is in contrast to some of the findings we have for our arrest data, even though, like I said, we don't want to overgeneralize that increase that we find in Part 2 offenses. We did want to explore it more to see if we see evidence of that in the data, and we do not seem to find evidence of increases in Part 2 offenses, at least in the cities that we're considering. We then consider other pathways that might be affected by cannabis legalization. One of the pathways is the drug use pathways. This is with the hospital data, and then systemic violence, which for assaults, we consider assaults and homicides. Assaults is with the hospital data, and homicides is with national vital statistics data. So columns 1 through 4 consider hospitalizations involving substance use. We look at cannabis and other illegal drugs like opioids, stimulants, including methamphetamine and cocaine. And then, and we look at cannabis use disorder or other illegal drug use disorder and poisoning, which would be, overdoses or poisoning events for the use of these substances. And what we find is that there is an increase in cannabis use disorder and cannabis poisoning across racial groups for both Black and white populations. When we look at other illegal drugs, we find increases, but only for the Black population. When we turn to, so it's unclear what is driving these increases in other illegal drugs. Part of it could be fentanyl. It could be that this is correlated with the increase in illegally made fentanyl. It could be related to a correlation between the production and consumption of cannabis and that of other illegal drugs. For the white group, it is positive, but is not significant, the coefficient for other illegal drug hospitalizations. Then when we switch to systemic violence, do we see any evidence of changes in systemic violence? The assault outcome, which comes from hospitalizations, even though it seems for the Black population to be negative, is statistically insignificant. It is also statistically insignificant for the white group. When we switch to homicide, we do see some evidence of declines in homicide deaths, specifically in the Black population. we do find that this is mostly driven by California and Massachusetts, but it is suggestive that at the very least there are no increases, and we don't see evidence of increases in systemic violence or assault, hospitalizations, or homicide deaths. And it's possible that there are decreases in some areas. And yes.
Angelica, sorry, I have a question. It's about the mechanism, but some slides ago about law enforcement by a person that asks the following. You find declines in cannabis arrests, but only white populations see reductions in drug-related prison admissions. How confident are you that this is driven by differences in what happens after arrest, such as prosecution, sentencing, and diversion, rather than differences in offense severity and criminal history?
That is a really good question. So we are unable to sort of link, these data sets are not linked to one another. And so like I cannot tell. So I don't see the sort of the histories of arrest and then incarceration and then and also the incarceration data does not provide specific substances involved in the incarceration. It just says drug offenses. That's all that I know. So it's very hard for me to tease and for us to tease out what of the mechanisms can be explaining what we are observing. What we are seeing here in the prisoner data is these are admissions, prisoner admissions. So this is coming from this is more likely to reflect, this is likely less influence. So panel D looks at prisoners at year end. This is sort of like the entry of prisoners. So it might be more connected, I guess, to arrests than, or more, it could correlate with arrests a little better than if this instead looked at total prisoner counts at a given point in time. But I am unable to tease out the mechanisms that you are proposing in my data.
Thank you.
In this here, so to finalize for the systemic violence, these findings sort of align with what we see here for criminal activity. We just don't find any evidence that cannabis legalization increases serious criminal activity, which is a concern that is proposed by many opponents of cannabis legalization. And we do see, some of the public health consequences of cannabis legalization through increases in cannabis hospitalizations. And this does coincide with prior literature that does find increases in measures of cannabis use and use disorder following legalization. So to conclude, so we've seen a lot of tables and estimates, but in a nutshell, we find that following cannabis legalization, arrests for cannabis sales and possession decline across all racial groups. We see also declines in arrests for other drug sales, but insignificant effects for possession. Again, this could be due to changes in illegal drug markets or in the enforcement of, and law enforcement priorities following legalization. We see declines in incarceration for drug offenses among white persons, but insignificant effects for Black persons. A variety of things can explain this. It could be related to the declines in arrests that we see. It could also reflect the fact that there could be differences in prior criminal histories between Black and white populations. Prior research, for example, suggests that white persons are more likely to be put on drug diversion programs relative to Black persons, and that this might be due to differences in their histories and in their criminal records. It could also just be related to, a variety of factors. Unfortunately, our study is unable to tease out, what can explain these disparities. For non-drug offenses, we find some evidence of increases in arrests for non-drug offenses among Black persons. that is driven by less serious Part 2 offenses. But again, these findings are not very robust. So we sort of take them as suggestive and not as, these findings need to be investigated a little bit more. We find null effects in incarceration for non-drug offenses across all races, and null effects on total arrests across all races, and null effects on total incarcerations across all races. As for criminal activity, we see increases in cannabis use disorder hospitalization across all races, which might, it might be suggestive of the pathway on psychoactive effects. We do not see evidence that systemic violence increased, and in fact, possibly increased among Black populations for the homicide group. And we also find that criminal activity did not increase and possibly decrease in Black neighborhoods. Both Part 1, some evidence of Part 1 and 2 declines in some states and overall. And that is it for me today. Thank you so much for having me.
Oh, thank you. So thank you very much. Perfectly in time. I think we still have 2 minutes for questions or any curiosity by the audience, if anyone has any. All right. No specifically. So I have a question, if so, taking advantage of my position. So the difficulty here is always understanding the mechanisms and what's going on, because many things move at the same time, and there may be a reaction by everyone, including social norms and everything. So just according to you, what's your favorite story among the many? What's your favorite mechanism among the ones that you have analyzed and studied a bit?
Well, I think that the way we think about it is as follows. When we're when thinking about should we legalize cannabis, we are afraid of increases in crime. We are afraid of increases in DUI. We're afraid of increases in substance use. We're afraid of increases in a lot of outcomes that are associated with substance use, right? And, we do not consider in this study the full range of outcomes that might be affected by substance use, but we try to focus on a variety of outcomes that might be affected by cannabis legalization and that are correlated with criminal activity. And we can say a few important things. One is there's a decrease in arrests for cannabis defined offenses. There's a decrease in arrest for non-cannabis drug sales. However, these declines aren't large enough to move the needle on total arrests, and disparities remain. Even though there's a big decline in disparities for these specific outcomes, disparities remain, and there's really no big changes for total arrests. And we're also able to say, in terms of the mechanisms, we're able to say that we do find evidence of increases in cannabis use measures via the hospitalization, which reflects some of the public health costs people do mention. But overall, we don't find, that there are changes in criminal activity, especially not for very serious offenses. And this coincides with what other studies have found. And we do not find that we don't find increases in these measures, and we definitely do not find that they are larger in minority communities relative to non-minority communities. So, well, I cannot really say what is my favorite pathway. I can say that we do find that some of the costs people mention associated with legalization, we just don't find evidence of them happening. And I think that is a really important finding to demonstrate, especially if legalization will be adopted by other states or federally going forward.
I agree. Thank you. So, Tina, do you?
Yes, Thank you very much, Angelica. Thank you for a great talk. I
Thank
really
you.
enjoyed it. And before we log off, I just wanted to remind everybody that our next talk is going to be on March the 2nd, and it's going to be Michael Darden of Johns Hopkins University. And I'm actually just going to, share that date and the name in the chat box if anybody wants to copy that down. But of course, you will get emails with a Zoom link also through the traditional channel. So yes. So thank you so much for joining this month, and we'll see you next month. Take care.
And congratulations. Oh, okay, she went. Okay, so see you, Tina. See you,
Yes,
everyone.
take care.
Bye.
Bye bye. Cheers.
Bye.
Bye. Bye.